Hi, everybody. Today we are answering the question, caregiving, what matters most? And I'm going to talk about 4 things that begin with the letter M. So a lot of caregivers will respond to these YouTube videos with questions or ask questions on social media or fill out the survey on my website, PamelaDWilson.com, with questions about what is most important to know about caring for elderly parents or a spouse. And truly, there are so many things. It's a very long list. So today I'm going to talk about 4 things specific to health and well-being and how you can help a parent maintain their health, how you as the caregiver can take care of your health, and how the healthcare system is finally starting to pay attention to what they call age-friendly care, which means that doctors are taking more of an interest in the fact that older people do need different medical care. Older people do need to be treated differently. They have health issues, much like babies on the other end of the spectrum. I'm Pamela D. Wilson. My website is PamelaDWilson.com. A lot of helpful information there. My podcast, articles, my caregiving library, online courses, and here on YouTube, there are hundreds of videos answering caregiving questions. So let's talk about the 4 M's. Number 1 is what matters most. And when we think of what matters most, we're talking about what matters most when care and health get very complicated. So when your parents have a lot of health issues and there's a lot going on, it's important to have conversations about what kind of extensive care would your parents really want. And as the caregiver, it's important to balance your feelings of love and attachment and wanting your parents or your grandparents or your spouse to continue to go on with life, even if they're very sick, because you want them in your life. So it's a balance of talking about, does a parent have cancer or 5 medical conditions and they don't feel well every day? And are you as the caregiver trying to push them to do things like, eat more, exercise, get better nutrition, consider surgery, things that may not really make a difference for those health conditions in the long run, but they may make your parent feel a lot worse or cause more pain or cause more suffering. It's a difficult topic to talk about, and I'll be doing more videos on this subject. So it really is what matters most. Does my quality of life matter most? Am I happy? Does that matter most? Or is what matters most the fact that I'm going to do all of these things that I don't want to do as a parent for my children who are pushing me to do this? And you can reverse that and say, as a caregiver, should I really push an elderly parent or a spouse or somebody to do all these things if they really don't want to, and if it really isn't going to help the situation? Big question is, how do you know, right? Number 2 in the list of 4 things for caregiving and what matters most is mobility. And I talk about this one all of the time. Elderly parents can't live independently long term if they can't get up and get around the house and take a shower and get up out of a chair and get in and out of bed. If they become physically weak, they become more of a fall risk. They're going to need more care. They may end up breaking a hip, and that can really limit their ability to get around. And then they're afraid that they're going to fall, so they're less active. So I can't stress mobility enough. And mobility really is that horrible word. It's the exercise word. You have to get up and move every day. You have to walk and strengthen your muscles and do things. And it doesn't matter if you're 20, 50, or 90. It's important. The next one is what we call, or what the healthcare system calls, mentation. They have all these crazy words for things, right? Well, mentation is really up here. It's your mental health, but it's also, are you depressed? Do you have memory loss? Are you suffering from any type of sickness that can affect your mind and your thinking? So for example, a lot of older adults who have dementia, or maybe they are dehydrated or malnutrition, they'll get very mentally confused. And the healthcare system calls that word delirium. And when that happens, delirium is usually caused by an infection or something else. So maybe urinary tract infection or pneumonia or something else. It's very important to get medical treatment right away for that because it can become very serious with our older parents who are 85 or 90 and infections flare and they get very, very sick. So it's important to pay attention to anything that really affects us up here and to get it investigated and treated. And then the last in the list of the four for what's important for caring for elderly parents is medication management. And this is one that can be a little challenging, especially if you are a person who thinks that, oh, I have a healthcare problem. I guess I'll just take a medication. A pill will solve that. Well, a pill will mask the symptoms. It may not fix the problem. And then what happens is once you get one health condition, you have two and you have three, and then all of a sudden you're taking 2 medications and 4 medications and 6 medications. Well, the older we get, it's more difficult for us to metabolize those medications. They have side effects. So one medication causes another problem that then you have to take a medication to solve the problem that medication solved. A lot of issues here. Talk to your doctors about medication. Pharmacists can do consultations about medications and side effects and things like that. And the last thing that I want to mention in this list of what matters most, these 4 things, is a benefit that many older adults don't even know that they're eligible for. Once you hit age 65 and you have Medicare or a supplement and you've been on it at least for 12 months, it's 2 things. It's an advanced wellness visit and advanced care planning, annual wellness visit. Medicare pays for both if you do them at the same time. But the good thing about doing this, especially if you are a caregiver for an older adult and you don't know how to have these conversations about what matters most or medications or health diagnosis or how to make plans, the physician can actually help start these conversations by doing both of these Medicare approved programs that are paid for by Medicare to talk about what do you want? Do you want really advanced care when you're older? How much extensive treatment do you want? What medications do you take? What are your health issues? How are you going to plan for all this? It's a really good way to begin a conversation with aging parents about healthcare, especially if you don't know how to start those conversations. Help your parents make that appointment with their primary care doctor or whoever they see, and then actually attend that appointment with them. I'm Pamela D. Wilson. My website is PamelaDWilson.com. Thank you so much for being here for this video. Please press the share button. Share this video with other caregivers, other people caring for friends or family members who are looking for a little bit of hope, help, and support. I'll see you all again soon in another video.